RGP lens insertion and removal. Steps to be followed by RGP lens users. Hand wash. Always wash and dry your hands thoroughly before inserting and removing your lenses. Follow the basic steps of standard hand washing technique. First, wet your hands under running water, apply soap, and rub palms together to ensure complete coverage. Clean the back of your hands. Make sure soap gets in between the fingers. Grip fingers on each hand. Rub your thumbs. Press fingertips into palm of each hand. Then rinse your hand under the running water thoroughly and dry them using a clean and lint-free towel. Do not touch your eye or lens with your fingernails. Make sure to keep your nails short. Lens cleaning and rinsing. Work on a clean and flat surface. You need a lens case, RGP solution, a box of tissue paper, a mirror, and a bowl. On the case, we have R and L written, which represents right and left eye. Open one cap at a time and take out the lens on your palm. With the lens on your palm, add few drops of RGP solution and rub the lens with your little finger for at least 30 seconds. Do not do the cleaning within the fingers. This can wrap or break the lens. Next, rinse the lens thoroughly with the same solution again. This will remove the loosened debris which remains on the surface after cleaning. Place the lens on the tip of the index finger of your dominant hand. Check properly the edges of the lens and also check that the lens is not deposited or damaged. Lens insertion. Take the non-dominant hand over the head and hold the upper lid and eyelashes tightly and securely. Now, holding the lens on the index finger of your dominant hand, pull down the lower lid with the middle finger. Look in the mirror and bring the lens up. Place the lens directly on the cornea. A light touch is needed to insert. You must keep looking through the lens or the lens will not be positioned properly. Lastly, release the lower lid first and then the upper lid. Blink slowly and gently until the lens feels comfortable. Follow the same steps for the other eye as well. Lens removal method 1. Using the two-finger technique. With the index fingers of both hands, hold the upper and lower lens edge. Gently push the lower lid upwards inwards towards the eye and at the same time push the upper lid downwards. This enables the lens to slide over the lower lid and out of the eye. The lens will now be positioned on the nail of the index finger. Hold lens with the adjacent finger to prevent it from falling. Lens removal method 2. Check the lens is in the center. Open the eye as wide as possible. Point out the index finger of the right hand for the right eye at the outer corner of the eye, elbow pointing straight. Pull up and out and then forcefully blink. The lid margins will catch the edge of the lens and the lens will pop out. Remember to put the other hand below to catch the lens from falling. Lens insertion with assistance. In case of lens insertion by an optometrist or a family member, follow the same steps of lens insertion as discussed previously and put the lens directly at the center of the cornea. Lens removal with the assistance. For lens removal, ask the patient to fixate straight and follow the method 1 or the two-finger technique of the lens removal. Lens care and storage. After removing the lens, place the lens on your palm and follow the same steps of cleaning and rinsing. Remove one lens at a time and store it in the respective side of the case. Before that, clean the case with the solution. Then fill the case with the solution again and soak the removed lens in the case overnight for at least 6 hours. This will disinfect the lens.